The goal of this video lecture is to review the diagnostic criteria for the different anxiety disorders that are classified in the DSM-5 and to discuss the characteristics that distinguish these anxiety disorders from one another. So, anxiety disorders are disorders that are characterized by excessive fear and anxiety and related behavioral disturbances. And these anxiety disorders are distinguished from non-disordered anxiety or fear by anxiety or fear that is excessive, so more severe than other anxiety, persistent, so anxiety or fear that persists for longer than is considered adaptive, or anxiety or fear that persists beyond a developmentally appropriate period. So anxiety and fear responses are experiences that all individuals have that are normal and even adaptive in many circumstances. But when the experience of anxiety or fear is disproportionate or excessive, persists after that anxiety or fear response is adaptive, or when anxiety or fear is experienced that is not developmentally appropriate compared to most individuals of a given age, that's when we would consider anxiety or fear to be indicative of an anxiety disorder rather than an adaptive anxiety or fear response. There are a range of disorders that are classified as anxiety disorders in the DSM-5. These include two disorders that are primarily diagnosed in childhood. Those include selective mutism and separation anxiety disorder. We are going to focus on the 5 anxiety disorders that are most commonly diagnosed in adults. These may also be diagnosed in children and adolescents, but for the purpose of today's video lecture, we will be focusing on the anxiety disorders that are more common in adults than children. These include specific phobias, social anxiety disorder, also known as social phobia, panic disorder, agoraphobia, and generalized anxiety disorder.